I'd now like to invite State Senator Michael McLaughlin from the 24th District.
Hello, everybody.
Hello.
So, happy birthday to Nord. They're my neighbors. I wave to their office almost every day because for those of you that have ever been to the Danbury Fair Mall, they're right there. So you can come and visit Nord someday. I want to thank the organizers here today for raising the issues that are very important in this world. And that is that the resources that are necessary for special focus, you are reminding legislators by your presence today. And that's very important. We are inundated with information, absolutely overwhelmed with information. In fact, in the last 2 days, I've gotten 1,000 emails about gun control. So just put that into context. It's really overwhelming sometimes. And so I ask you to continue your advocacy, and thank you for all that you're doing. Thank you for being here today.
We're now going to move on to some more patient stories, but I just wanted to say thank you to all the representatives who came today and spoke. It's, as a longtime resident of Connecticut, it's really great to see the support from our elected officials, and I really thank you for being here. So, we're now going to invite Stephen Bajardi from the International Rett Syndrome Foundation and one of the Nord board members to speak.
Well, thank you and hello everybody. I want to say hi to everyone who came out for Rett Disease Day. Since 1994, I've been a board member of Nord for all but maybe 2 years. So I'd like to especially thank the state of Connecticut for its support. Connecticut has always seemed to be very sympathetic to Rett diseases and has supported Nord for many, many years. So I think we should acknowledge the work they've done because it's not present in every state in this country. For my day job, I'm the executive director of the International Rett Syndrome Foundation. Rett syndrome is a genetic neurological disorder. It affects 1 in 15,000 births. It occurs almost always in young girls between the ages of 6 months and 18 months old. And it is accompanied by symptoms that require 24-hour, 7-day-a-week, lifelong care. IRS funds translational research. We're funding a couple of clinical trials to develop treatments. And we provide family support so that families and children can find the best resources available so they can live a life as full as they can. Like all rare diseases, diagnosis is a problem. It is a painful and long journey for many. It could take 5, 6, 10, 15 years sometimes, and misdiagnosis is a huge problem. It is a painful journey for families, especially having to travel to other cities and states and sometimes not even getting the answers they need. Like all other rare diseases, treatment is a matter of good fortune and circumstances. You happen to live somewhere where there are good people locally who are educated on your situation. Oftentimes it's just happenstance that people actually see a neurologist who knows about Rett syndrome or other rare diseases. And like all other rare diseases, discrimination is a fact of life on a daily basis, whether it's in a school setting or socially or commercially. It's an extremely unfair and very painful thing for all families to endure. There are an estimated 220 cases of Rett syndrome in the state of Connecticut. These children and their families and many others who are affected by rare diseases appreciate the support from the state and hope that in the coming difficult years, you've heard much about the budgetary issues that the state of Connecticut is facing, like many states, and of course our national government as well. But we hope that in this process, rare diseases are not forgotten and people's needs in the state are not forgotten. And hopefully the state will avoid the kind of situation that's happening in Washington where priorities aren't being met, important things aren't being identified, but basically, blanket, very cruel across-the-board cuts. So thank you all for coming out today on behalf of Nord and the International Rett Syndrome Foundation. And again, I'd like to recognize the state of Connecticut. We've had a very warm and good home here for many, many years.
Next, I'd like to invite Felicia Brown Coleman to speak. I'll let her tell you her story.
can do it. Slow and loud.
Hi, good afternoon. My name is Felicia Brown Coleman, and I'm here to speak about a rare disorder called Cornelia-de-Lange syndrome, or CDLS. Cornelia-de-Lange syndrome is a genetic disorder that is present at birth, but is not always diagnosed at birth. My daughter was not diagnosed until she was 1 year old. When my daughter was diagnosed, I was introduced to the foundation, and through the foundation, I was connected to other families throughout the U.S. that have children with Cornelia-de-Lange syndrome. The foundation has provided my family with an abundance of support, like giving us information about specialists as far as geneticists and doctors that can help Raven with other issues that she has going on in her life right now. Raven is now 11 years old, so I'm blessed that, I've had a very long time with Raven, and I'm looking for many more years. Having a child with a rare disease has been a very difficult journey for my family. I never imagined that having a child with a rare disorder or a disorder of any kind would be so difficult, from education to specialists. For example, with Raven, speech, physical, and occupational therapy was denied by insurance. So I was forced to, with speech therapy, I paid out of pocket for my daughter until we could no longer afford it. So then speech therapy was discontinued with my daughter. Although she is making progress, she is the one that is suffering now because I cannot afford to pay for out-of-pocket therapy on a weekly basis for Raven. As far as physical and occupational therapy, we got creative as a family. We put her into dance class. Although it's not considered formal physical therapy, it is a form of physical therapy, and it does cost less than paying for physical therapy sessions. Education with my daughter, she actually went to school at 4 years old. We knew she was going to be held back for a year just to see how she transitioned from home to school, and I guess also to see how her mother transitioned, letting her go away for a little while. But there truly seems to be a lack of adult support employees in the schools in the Hartford, West Hartford area. Summer school is another situation entirely. With Raven, there is no place that I can send Raven to and not have to send someone to be on her side. For example, 2 years ago, I put Raven into a summer program, and they required that I have a family member or someone with her, not paid, to assist with her feedings and her changing. So basically, a family member had to make a sacrifice for Raven to give up what they were doing for the summer to be there with her, and I'm paying a facility to watch over her being cared for by someone else. But because of her age, legally I couldn't have them home together. My family and I have faced barriers in every aspect of Raven's life. When Raven was diagnosed, we did not know what to think or where to turn. Sometimes we felt very alone. However, when coming into touch with the CDLS Foundation, my family gets the support from the foundation and other family members. They have connected us with families and specialists and had made us feel as though we're not alone in this journey when we originally felt that it was just us, because when we got the diagnosis, we were like, I'm in the medical field and I've never heard of Cornelia-de-Lange syndrome. And I'm just lucky and fortunate that they happen to be in Avon. So that's my story, and I thank you for me.
Now I'm going to invite Jean Kelly up to talk with Brian Snow.
Testifying for a bill for newborn screening, and this is much more relaxing. However, I thank you all for your support. This is my son Brian. My name is Jean Kelly. Many of you here today know what it's like to watch someone we care about struggle with illness and the frustration and sadness of not being able to take away their pain. This is my story on that subject, and I'm here today because someone I love has a rare disease. As the youngest of our 3 children, Brian enjoyed many happy, vibrant, active years. Every bit a young boy, blending heart, mischief, curiosity, and energy, swimming and skiing black diamond trails. We are so grateful for all those fun times of health and happiness. However, at the age of 6, our world changed suddenly. While sledding, Brian collided with a woodpile. Since he seemed a bit dazed, we brought him to his pediatrician, who referred us on to the hospital for a CAT scan and further on for an MRI. On the 28th day of February, exactly 18 years ago today, today, we were told the devastating news that Brian had adrenoleukodystrophy, a debilitating neurological disorder. The incidence is 1 in 17,000 and it is an X-linked disease, so it is passed through women to their boys. So their boys manifest the disease and their daughters can be carriers. Because Brian was already symptomatic at the time of his diagnosis, we were told there was very little we could do. Had his condition been detected at birth, the course of his life would have been radically different. A bone marrow transplant 3 months later saved my son's life, but within 6 months of his diagnosis, Brian lost his mobility, his speech, his ability to eat, and most of his vision. With the help of the Kennedy Krieger Institute in Baltimore, an affiliate of Johns Hopkins, and the Mylan Project, of which I am a board member, we were able to get help and much needed answers. But the ravages of ALD had left Brian profoundly impaired. Yet, in every moment we have with him, there are many countless blessings. With the help of our loving family, an amazing hometown community of Branford, Brian has graduated from high school and continues to inspire people, myself included, every day. He has a quiet tenacity and despite his physical challenge has much to express and teach others. He has shown me, my husband, his sister, his brother, how to be deeply compassionate, resilient, and strong. We have watched him exceed every doctor's prognosis year after year, and in turn, we have learned to live with great hope because of him. For those of you here today who know or care about someone living with a rare disease, most of us, it's wonderful being in the company of people who know the challenges. It is my hope that you take this message, a message of the strength of hope, with you. We have created a foundation to honor Brian in this message. Our goal is to broaden awareness of standard newborn testing, all in the hope that no child will have to experience the struggles that Brian has. And we've established Brian's hope, and that will be Brian's legacy. And hopefully we'll pass Bill 465, and there will be a newborn screening for adrenoleukodystrophy. Thank you.
Thank you. Mary Caruso, you want to come up?
Good afternoon. That'll be a tough one to follow. I assure you there was some very open dialogue and few arm wrestling competitions before it was decided that I would be the person to speak for our family. I will take you on more of a personal journey, but please don't let that diminish the importance of these two amazing young women up here with me. I am merely their life facilitator. I'm their go-to person. My daughters live with a rare disease called Friedreich's ataxia. It's a debilitating, life-shortening, degenerative neuromuscular disorder affecting about 1 in 50,000 people in the United States. Childhood onset usually occurs between the ages of 5 and 15 and tends to have a more rapid progression. My older daughter Sam was diagnosed at 8 years old, never really having a chance to develop any coping skills needed to understand and overcome the effects of the disease. Before she began to lose abilities, she was an avid sports player. She played every sport out there, strong and fast. She watched all sports games and learned about every aspect. Her dream back then was to work at ESPN, a dream she continues to pursue with vigor today. She navigated her way through grade school, beginning to fall down, using a walker in middle school and then a wheelchair. Each year losing more friends, fighting to be accepted, trying to understand why she didn't fit in with the student body or the administrators who were responsible for teaching acceptance and understanding differences. She worked every summer during high school and throughout college. Alex, now 22, was 4 when Sam was diagnosed. Of course, I was given the added news that Alex had a 1 in 4 chance of having the same ill-fated diagnosis. She was already in dance lessons for a year and had a natural love for dance. She danced around the house endlessly, being dubbed my tiny dancer. I spent about 1 year watching her tirelessly before I would also admit to myself that she too would slowly and steadily lose her mobility, also giving her life with this rare disease. Unfortunately, seeing this through her sister of what would lie ahead. Alex will graduate in May with a degree in social work, a member of 2 honor societies, and an intern with the state's attorney in the Office of Victim Services. Alex has the added challenge of her speech being affected, which has presented additional obstacles. She has worked very hard at Gaylord Hospital, using various techniques to improve her speech along with the quality of her life. Recently, our insurance has informed us that they will no longer pay for that, information we receive frequently. But life does go on. It certainly took a new meaning back in 1995 when given the diagnosis. All 3 of us have had that small taste of normal before being catapulted into this life filled with loneliness, challenges, and uncertainty. We find the courage, whether it is through strong faith or incredible determination. We find the courage to stand up for our rights. We have supportive people in our community. They're the ones who hold us up on the days we can't stand any longer. We gain strength and we carry on. We have found friends and allies at the FDA, NIH, NORD, the Friedreich's Ataxia Research Alliance, universities, and others who hold the key to treatments. We have learned how to navigate and how to make a negative a positive. We have learned how to communicate our frustrations and turn those frustrations into action. Through our dear friend, State Representative Vincent Candelora, and through Congresswoman Rosa DeLauro, we have learned how to be instrumental and make positive changes in this world. At the end of the day, we sit together. We thank God we have each other, and we get ready for our next day. We stay positive because we know each time we make a change in this world, people notice. They see the girls as integral members of society. They don't see the wheelchairs, they see accomplishment. They don't notice difference in speech, they see beauty in their hearts. We have looked at the loneliness and isolation of this rare disease and faced it head on. We remain humble and dignified, and we hope we can teach by example the importance of practicing kindness, having respect, accepting everyone, and treating all people with dignity. Thank you so much for inviting us.
All of our patients for sharing their story today. I think it really demonstrates the differences, but also all the similar challenges that people go through when they have rare diseases. We're going to change pace just a little and talk about another really important aspect of the rare disease community, and that's the collaboration between industry and patient organizations, and how they can work together to help promote the development of treatments for rare diseases as well. So Michael Lasso from Onyx and Sarah, if you want to join us.
Hi, I'm Sarah. I'm with the Multiple Myeloma Research Foundation, and we're based here in Connecticut in Norwalk. And Mike Lasso is with Onyx Pharmaceuticals, and one of the things that we wanted to talk about is the way our foundation works together with industry and academic institutions to bring forward new research, clinical studies, and most recently we are very happy to say that we were very much involved in bringing forward a new treatment for multiple myeloma, actually two, in which we collaborated with Onyx Pharmaceuticals. And Mike can talk a little bit more about the way we collaborated together with industry.
Again, I'm Michael Lasso with Onyx Pharmaceuticals, and we're a company that focuses on cancer treatment. We have 3 products, and almost all of our treatments are for rare cancers. Liver cancer, kidney cancer. Last week we got approved for GIST, a rare stomach cancer. But I'm actually here. Our CEO starts every one of our internal meetings reminding us we're here for the patient. And I want to say we are here today because of Representative Miller. I met Representative Miller last summer at a conference in Salt Lake City, and he started telling me about our product that was not yet approved for multiple myeloma. This product, which Sarah just referred to, it was at accelerated approval through the FDA, and it's because of the collaboration we had with the Multiple Myeloma Research Foundation. Because of them, they helped us design our clinical trial protocols. So the protocols for the clinical trial was designed to be best adaptive to the needs of people with multiple myeloma. So scientifically it was going to be valid. Our scientists are good at that. But in terms of making it best for the patient, came from them. Then they helped us fill those clinical trials rapidly. And that's one of the hardest and most expensive parts of drug development. Again, because of them, we filled the trials quickly, and with the science that came out of it and what we learned, we got accelerated approval and the product on the market. And I'm very happy to say that Representative Miller's in a great position because he's got the traditional treatment. This product was approved for when it stops working. So our product is now available to keep him alive even longer when his traditional products, if they stop or no longer work as well, we will continue to keep him around for a while.
Mike just give me his telephone so I can call.
So for us as a company that produces products, we're all about the patient and the collaboration.
Right. And then on behalf of the MMRF, we're very proud to work with Onyx for the development of Kyprolis, and then also most recently improved Pomlis, which was approved about 3 weeks ago. So it's very, research is definitely very promising, and that's part of our mission actually, is to bring next generation treatments to myeloma patients and forward the research and hopefully one day find the cure for this blood cancer. Thank you. And thank you to Nord for having us here participate.
So I think that concludes our program, unless there's anyone I missed. So I don't know if anyone who's joined us has any questions. I'd be happy to take some questions. Anyone in the room? Great. Well, in that case, I'd like to really thank everyone once again for joining us today. This project was modeled off of something that was done in Massachusetts for the last 3 years with a collaboration at their state capitol. And I hope that Connecticut can continue this tradition and have a strong event in years to come, and hopefully we'll need an even bigger space next year so we can hear even more stories. But thank you all for being here.
Thank you.